Hello, and thanks so much for joining me for this presentation on becoming a physician assistant. My name is Brianna Cardenas. I am a Master of Science in Physician Assistant Studies, a Physician Assistant Certified, that's the PAC, and a Certified Athletic Trainer. That's what I got my bachelor's in. If you'd like to stay in touch with me or have more questions about our program, go ahead and take a picture of this QR code and feel free to reach out to me via email. Reach out to our program director at the University of Verne via email as well, or feel free to connect with me and follow me on Instagram, and my contact information is all listed here. So let's start with some of the basics. Let's find out what a PA is. PA stands for Physician Assistant, and I'll be using the term PA from this point forward. A PA overall is a medical provider. We're considered mid-level healthcare providers because we work alongside doctors, nurses, and all aspects of the healthcare team. So we're considered mid-level healthcare providers. And as mid-level healthcare providers, some of our responsibilities are to diagnose illnesses, create and manage treatment plans, prescribe medications, and we can be primary healthcare providers. Overall, we collaborate with other members of the healthcare team to make a great patient experience. So where do we work? PAs work across the United States. There's over 120,000 of us and working in various settings, from hospitals to medical offices to retail clinics like CVS, where you go and get the flu shot, workplace clinics, correctional institutions, the armed forces, and the Department of Veterans Affairs. What can we do? Well, primarily we see patients, but part of those duties include taking medical histories, conducting physical exams to really find out what's going on with the patient, diagnosing and treating illnesses, whether that's from a behavioral health standpoint or mental health standpoint, or a physical illness, because mental health care is health care. So along that spectrum, we can order and interpret tests as needed and develop treatment plans. At the University of Verne, we really try to emphasize the holistic treatment plan, which means treating the whole person and taking into considerations things like the medications they may be on, their desire to have preventative care in place, their desire to keep cultural norms or respect some of their personal beliefs as far as that pertains to managing their health care. In addition to making those treatment plans, as physician assistants, we can perform procedures like injection therapies, we can deliver babies, we can assist in surgeries, and we make rounds in the hospitals and in nursing homes. And one of the cool things about being PAs as well is that we can do clinical research to essentially forward the understanding of our field in healthcare as we know it and make new medical discoveries. And overall, PAs can work in every specialty of medicine, and believe it or not, we can do multiple specialties at once, and that's one of the great flexible things about being a PA. Our profession continues to grow. The demand for PAs increased over 300% from the year 2011 to the year 2014, and it's projected to increase another 37% over the next 7 years. So from 2016, we've seen a pretty on-trend growth curve along with this 37% figure, and we've had significant job growth. I have been a practicing physician assistant for 6 years, and when I first started working in physician assistant roles, my starting salary was around $80,000, and now the starting salary is over $100,000 a year. So in addition to having an increase in growth from just a job market perspective, we've also had a huge increase in growth in our salaries as well. So going on and taking a look at kind of where we fit into the healthcare model as physician assistants. Healthcare has a lot of problems, so that's kind of a big topic to tackle. But as far as the healthcare problems go, PAs certainly aren't one. So doctor shortages are a big problem with the healthcare field in general. So I'm sure all of us here in this room have had an experience where we've gone to the doctor's office and we've waited and waited and waited some more, and finally you get into that office and you only get to spend 10 minutes with your healthcare provider. So if that sounds familiar, being a PA is one of the ways that we can help mitigate that wait time and really bridge the need for healthcare providers. It takes approximately 8 years for a doctor to become certified from the time they start their program until they can practice and see patients independently. That time for physician assistants, depending on the program where you go, is 2 to 3 years. So our program at the University of Verne is 27 months, so that means when you graduate college with your bachelor's degree and start in our program, less than 2.5 years later, you can go out and start seeing patients. Another big issue with healthcare is the rising costs. So essentially the costs of healthcare are continuing to increase at an astronomical rate, with insurance premiums costing the patients more, the cost of medical care costing the insurance more, and just people becoming more and more sick due to the fact that they kind of get the short end of the stick when it comes to all of this. It turns out that the patients really end up paying the brunt of those costs, and they pay the price when it comes to their health care and their mental health care. The delayed time that it takes to see a physician or a physician assistant or a mental health care provider can really start to be solved with the fact that more PAs means more healthcare providers out there to service the needs of these healthcare deficits. And also, in general, PAs make less than physicians. So PAs' cost to healthcare institutions is definitely much less money. So you can have essentially one doctor, or you can hire 2 to 3 PAs depending on the specialty that you work in. So it just makes sense for PAs to be enrolled in essentially the healthcare institutions regardless of what level that you work at. Also, PA education costs way less money and takes way less time than it does to become a medical doctor or a doctor of osteopathy. So PA education, like I said earlier, it ends up only taking about 2 to 3 years as opposed to about 8 years as a medical doctor. Also, the cost for tuition for medical school can be upwards of $500,000, and at various institutions they are about $100,000 to go to school and become a physician assistant. So it's literally around 1/5 of the price. Another big issue with healthcare is that medicine has become very specialized. A lot of doctors go out and they specialize either in neurology or cardiology or pulmonology or mental health, and what ends up happening is we have all these people looking at the same thing and they get so zoomed in that they lose track of the big picture. So the picture you're seeing here is the parable of the blind men and the elephant, which is essentially where an elephant is in the presence of multiple blind men and they can only feel a piece of the elephant, and the person feeling the tail says it's a rope, or the person feeling the side of the elephant says it's a wall, the person feeling the ear says it's a fan. And then what ends up happening is you have 6 different people with 6 different opinions because none of them see the big picture. And so the ways that PAs can help bridge that gap in care is the fact that we are all trained in primary care. So physician assistants have training in primary care specialty, which means we understand the body as a whole, and we don't spend years and years and years getting so zoomed in on a certain body part that we start treating people like we treat our cars, right? There's something wrong with this body part, or there's something wrong with that body part. We can remember that, hey, this person is a human being. They are more than the sum of their parts. All of their thoughts, experiences, their behavioral health, their culture, their religion, their background, all of these things play a role in what their general healthcare picture looks like. Also, we can work in multiple specialties at one time. So if you have interest in, for example, orthopedics, and also the behavioral health side of how sports injuries affect someone's psyche or their psychology, you can work in both of those specialties at once. And you can really pick and choose which specialty you'd like to be in. So I have a friend, for example, who does urgent care, men's health, and also worked in primary care at the same time. So you can absolutely work in whatever specialty you'd like. My specialty was chronic pain management because I felt that it's really important to get to the root of a person's problem rather than just give them medication to manage pain. So I really liked chronic pain management because it was kind of a blend of doing orthopedics and sports medicine in addition to mental and behavioral health. So one of the big issues, lastly, with the current trends in healthcare is that physician burnout and depression is at an all-time high. Seeing patients and the demands placed on our providers, the struggle is real, right? So people spend all this money to go to medical school. They spend 8 years of their lives training for this day that they get to be a doctor and they go out in the world and then they realize that they are just exhausted, and the charting and the paperwork and the hours that they spend at work and feeling kind of like a cog in the wheel or just too many bureaucratic tasks like paperwork and charting really burns a lot of these physicians out. And so in 2018, the physician reported burnout and depression rate was 42% of healthcare providers. And when you combine that all together, you can see that over 50% of providers experience either burnout, depression, or both. And those kind of things can really impact the care that people get, because as you've all learned with mental health, depression affects so many things. It affects people's sleep, it affects people's mood, their appetite, their ability to function and think clearly. And if you imagine that literally half of the doctors out there are feeling this way when they go to work, well, that becomes quite a problem. So PAs can really help ease some of those burdens, and that way we can work together as a team with our physician colleagues to make life as a healthcare provider a little bit more manageable for all of us. So at the physician assistant level, we get to have more fun. So this is actually a screenshot of the AAPA, or the American Academy of Physician Assistants, most recent conference that was held in May of last year. And you can see that there's a themed party that we have at our national conferences. And I'd say that we have just an overall humanistic approach to the way that we see patient care and the way that we see our role in the healthcare community. Also, if we work for somebody that maybe the clinic isn't a great fit for us, or we get into a specialty and we realize, wow, I really don't like this specialty after all, well, no harm done. You can switch, you can go find another job, and because PAs are one of the most in-demand jobs in the country, you can find another job in a heartbeat and find a place that's a good fit for you. If you want to work part-time in Hawaii and you want to work part-time in Las Vegas and live in California, you can go ahead and do that. You can work in multiple states and multiple specialties at the same time, and you have a whole group of colleagues that have a similar approach to the work-life balance and really want to be there to make sure that we're in it for the long haul, and that way we can perpetuate a really positive culture in healthcare rather than seeing the rates of burnout, sadness, and just people really not liking their jobs when they go out into the workplace. So let's talk about how we become a PA. This process might seem like a really long process when we map it all out. So my suggestion is, if you're interested in becoming a physician assistant, get a mentor. I mentor PA students or pre-PA students all the time. I am a professor at the University of Verne, so I really enjoy mentoring the future of our profession and helping young people, especially people who are first gen, people who maybe have historically disadvantaged backgrounds, helping those people know that they do have a place in our healthcare community. They are important to our profession as a whole, and that they can succeed. That's one of my favorite things in the world, is to give people an opportunity to shine where in some other places they may not have had those opportunities. So first, you want to get into PA school. If you haven't finished high school yet, that's step number 1. But in the meantime, one of the things I would highly recommend is starting to volunteer. So start those hours now, because the more volunteer hours you have, the longer commitment that shows towards your commitment towards your community. At the University of Verne, we have a very strong emphasis on holistic care, rooted in the community, rooted in underserved areas. So if you volunteer already at your church, or you volunteer at school, or you're part of a club on campus, that counts as volunteer hours. The more volunteer hours you can get, the stronger applicant you'll be, and it's a lot easier to knock those hours out while you're in high school than it is when you're in college and that workload increases. So I would definitely recommend get some volunteer hours under your belt now before you even finish high school. Next, get to college. And when you're in college, the idea is to have approximately a 3.2 GPA or higher. This will make you a competitive applicant for any program in the country. This is going to be really important, so that way you can essentially be a competitive applicant and that you have a good chance of getting into a program. There's various prerequisite courses. They're varied a little bit depending on the program, and I'll go over those in a couple of different slides. If you haven't considered what you would want to do maybe as part-time work during college, I would definitely encourage you to gain some work experience, preferably in healthcare, as somebody in the healthcare field already. A couple of reasons for this are so that you understand how the healthcare field works and you understand what you're getting into, and you kind of get a sampler as, is this really right for me? Is this the field of care that I want to go into? Any field of medicine that you go into, you'll probably get to see PAs in action, and you'll make really good, strong networking connections where you can shadow physician assistants for hours and also really understand what that role looks like and what their day-to-day life is. You can ask them, hey, are you happy in your job? Hey, do you like what you do? Do you feel like you have flexibility? And asking those questions to a large group of PAs and to a representative sample of what the working conditions are like in the area where you want to work and live, there's really no substitute for that experience. So some entry-level healthcare jobs that you can get into, for example, are EMTs, which are emergency medical techs who ride on the ambulance. There's medical assistants. Both of those will take anywhere from 6 to 12 months to become certified. Other things that you could consider would be scribing, becoming a medical scribe. And that is something where you learn medical terminology, and if you can type really quickly, that's a really booming job right now, and that's really beneficial because you'll automatically get your patient care and shadowing hours built in. You'll get paid for your experience, and you'll know how to do electronic medical records, billing, and coding by the time you get out into your PA profession, which will be a huge help to you. So becoming a scribe is another really important and helpful tip. When you apply for PA school, after you've gotten all of that under your belt, you'll apply through a program called CASPA. I put those $ there because CASPA is something that can cost a lot of money. It costs $125 for your first application to your first school, and then $50 for every school after that. So if you say, you know what, I am not confident in my chances to get into PA school, so I'm literally going to apply to every program in California, well, you're going to be paying a couple $1,000s to submit your application through CASPA. My recommendation is find a couple of programs and find one that's a good fit for your style of how you'd like to deliver healthcare and apply to that school or those selective amounts of schools. It'll save you money, and it'll also make you a more competitive applicant, because your reason for wanting to go into school, if it matches the mission and vision of that program, you probably will be a better fit, and that's really important because you'll spend a couple of years of your life there. But also it'll make you a more competitive applicant if your mission and vision of why you want to deliver healthcare match up with the mission and vision of that program. Other things you can do while you're in college, and also honestly while you're in high school, if you plan on having to take out student loans like I did, one thing I wish I could have gone back and done a little differently is to have looked up more scholarship opportunities. So this website, CAPA, it's capanet.org. This is the California Association of Physician Assistants, and they offer multiple student scholarships for PA school. So definitely lots of scholarship opportunities out there, and I really wish that I would have done that differently and I wouldn't have had so much student loan debt when I left school. So pro tip, get you some scholarship money and you'll thank yourself later for the work that you do on the front end. Once you get into PA school, you'll need to survive PA school. No, just kidding. It's not as terrible as it sounds or as some people make it seem. It is a lot of work. It takes a lot of effort and work ethic, but depending on the program that you go to, it'll only be 2 to 3 years. So most programs are 12 to 18 months of didactic coursework, which means in the classroom, and the other portion of the program is 12 to 18 months of clinical rotations. So our program at the University of Verne is 15 months of didactic or in the classroom work, and then it's 12 months of clinical rotations. During this time, you get to network, you get a sampling of what life is like as a PA in multiple different specialties, and then you get to graduate and celebrate. Woo-hoo! Congratulations on all of your hard work, right? So if you want to find somebody who kind of gives some insight into this, either on Insta or YouTube, you can follow Life as a PA, and this lady is great, and she talks about what it's like to be a PA, what it's like to become a PA, and some pro tips on how to become a strong applicant. She also hosts weekly med takeovers on Instagram where people from various specialties host takeovers and show you what a day in the life of a PA in that particular specialty looks like. So highly recommend. So now what? You've graduated PA school, you've got a couple last steps, and then you're full-fledged and ready to work. So you've graduated school, now you can study for the PANCE. So the PANCE stands for the Physician Assistant National Certifying Examination. And all PAs who practice medicine must pass this national certifying exam. Once you pass this exam, you're eligible to work for any state in the country, and all the state requires is that you pay them that money so that they can have a license and issue you a license in that state. So I'm only licensed in the state of California because that's where I live. I don't plan on working anywhere else, but like I said, if you want to work part-time in Hawaii and take extended vacation there and just work a couple urgent care days in Hawaii to pay for your trip, then by all means, go ahead and just pay for that state license in the state of Hawaii, and then you can practice in multiple states. You don't need to retake a test or anything. All you have to do is pay for the license fee in that particular state. If you plan on prescribing medicines, especially controlled substances, you'll need to take what's called a controlled substance education course. This is usually offered by your PA program. Also, once you pass rotations and you graduate, while you're studying for the PANCE, you want to start interviewing with a couple different places and networking and really find out what's going to be a good fit for you and where you'd like to work. The reason that you start interviewing before you take the PANCE is because sometimes, especially at hospitals, it can take months and months and months to get all your paperwork cleared. So you'll want to make sure that you get that application and get that job locked down so that that couple of months while all of your paperwork's waiting to go through, you're spending that time studying, so that way you can take boards and get to work right after you pass your boards if you'd like. So then you pass the PANCE, and then you celebrate some more, and then once you find out, hey, I'm ready to go work, you apply for your DEA license, which is what you would need to prescribe medications, and then you can get to work. Whew, finally, we made it. I know it sounds like a long trip. You can absolutely do it, and especially with the help of a mentor, you can become a PA. So, once you're a PA, ideally, you'd like to stay a PA, and no judgment here if you decide that you want to pursue culinary school instead and being a PA is just not for you and your true love is in the kitchen. Well, great, you do you and live your best life, and that's great. But for the rest of us who want to stay PAs, a couple of things that you have to do to maintain your certification. So, every 10 years, you'll have to retest and take what's called the PAN-RE, which is the Physician Assistant National Recertification Examination. You can take that every 10 years. You'll also need to pay to renew your state license every 2 years and pay to renew your DEA license every 3 years. Whoever you work for, whether it's a doctor in a private clinic or a big hospital or a big chain of clinics, they should be paying for this kind of stuff. So when you negotiate your salary, that's part of your salary package, is that they pay for your test, they pay for your professional maintenance fees, including the state licensing and the DEA license as well. Also, you'll need to do 100 CME, or continuing medical education units, every 2 years. And that basically means you go to a few conferences, like the ones that I showed in the previous picture, and learn more stuff to keep your skills up to date and stay up to date with all the new advances in medicine. If you go to approximately 2 conferences per year, then you've most likely met your CME requirement. So the CAPA conference that's listed here, the CAPA conference is 25 CME, so if you go to that for 2 years, you've met 50 CME, and if you go to one other conference, that gives you approximately the same amount of CME throughout the year. Mine are usually pain management conferences. I have a friend who does nutrition conferences. If you're interested in mental behavioral health and you want to do psych conferences, you are absolutely welcome to do that as a PA, and you just have to earn that certification. So, next step, those are just kind of the basic things. Sometimes it goes without saying, but for some people, they need to hear it. My biggest recommendation in order to stay a PA is stay in your lane and don't be a jerk to your patients, right? So don't pretend to be a doctor once you're a PA. Don't pretend to be somebody that you're not and say that you have 10 years of orthopedic experience if you've never been in orthopedic a day in your life, right? So stay in your lane. Don't go outside of the scope of your practice. And don't be a jerk to your patients, right? Be kind to them. Give them the standard of care. Don't be dismissive. Really just treat them like human beings, right? And as long as you do those kind of things, your license will be safe and sound. It's when you start getting careless with prescribing meds, or you start being rude to patients and miss big important things, or start just not caring about doing your charts and that kind of stuff, that's when you can kind of get in some trouble and lose your license. So as long as you don't do those kind of things, you'll be A-okay and you'll be able to stay a PA until the end of your days. Also, since this is the profession that you'll be in for the rest of your life, make sure you get involved. So AAPA is our national certification, our national advocacy group, and CAPA is our California Association of Physician Assistants. So depending on what state you live in, you'll want to go be part of that organization so you can stay up to date with all of the legislative changes and all of the changes that affect our profession. So highly recommend staying involved. So now let's talk about the University of Laverne's PA program. Now that you kind of know what a PA is, where we fit in the healthcare system, and what it takes to become a PA and get that white coat, here's the things you need to know. So, the University of Laverne's PA program, we'd love for you to come join us. This is a picture of both of our cohorts 1 and 2, in one picture. So each class is about half this size because this is both of our current cohorts side by side. They get their short white coats as soon as they enter the program and become a PAS, which stands for a PA student. When you become a PAC and you're ready to go practice, that's when you get the long white coat. If you'd like to follow us on Instagram, come follow us at ULV PA program so you can stay up to date with all the goings on of our particular program. A little bit more about us. So one of the things that makes us really different from other programs and why I love working for the University of Laverne is because our mission is to educate diverse, ethical, collaborative, and holistic medical providers committed to eliminating health disparities. So, a health disparity is when somebody who has access to medicine has different health outcomes than somebody who maybe doesn't have that same kind of access. For example, think about a person who needs mental and behavioral health services and they're super rich and they have really great PPO insurance versus the person who is homeless and needs access to mental health services but they don't have insurance or a place to live. Their health outcomes will be very different, and we call that a health disparity. So our goal as a program is to train people to be reflective and remember all of these different types of people, that everyone deserves health care regardless of their socioeconomic status or the number in their bank account, and we really want to try to eliminate those health disparities as much as possible. Also, one thing about our program is we really want to make sure that we emphasize a diverse and collaborative group of people. So everybody, we want them to work together as a team. We want a diverse student background, and we really place an emphasis on holistic medical care. And holistic medical care doesn't mean that I treat all of my patients with lavender essential oil and meditation. Holistic medical care means that I consider the whole person when giving health care to people. So our students learn, hey, a person is not just a sum of body parts. They are not just a disease. It's not, oh, the patient with the rotator cuff in room 4 or the depressed patient in room 3. No, this person has a condition in which they deserve treatment for it, right? It doesn't matter what their other extenuating circumstances are. They still deserve access to care, but we need to consider all those things when it comes to treating the person. So seeing them as a whole human being with a condition that we can help treat, but also taking into consideration, hey, how is their mental health? How's their nutrition? Do they have access to food? What does their housing situation look like? Did somebody in their family just die, right? So thinking about all of the things that could affect our outcomes as healthcare or as people who need healthcare really helps us to take the whole big picture in mind so that way we can treat each patient as an individual. So a little bit more about our program. So our program is a full-time master's degree program. It takes 27 months, so a little less than a little less than 2.5 years. It's Monday through Friday, some weekends. We move in a cohort, which means the sequence curriculum goes all together. You go in with the same 30 people that you start with, and you end with the same 30 people, and you all take the same classes. Overall, it's 118 total units. These prerequisites, admissions, and special populations are listed on our website, so I won't spend a ton of time there. But one thing I do want to know about special populations is that we guarantee interviews to people that have met the following criteria. So if you're a University of Laverne alum and you go to the University of Laverne for undergrad and you graduated no more than 2 years prior to applying to our program, you're automatically guaranteed an interview. Now, that doesn't mean that you're guaranteed admission, but it means that you get an interview. And for our program this year, we had over 1,000 applicants, and we are only interviewing about 100 people. So having a guaranteed interview is a really, really big deal. Also, if you're a veteran or active military personnel, you're also guaranteed an interview in our program. So we definitely have a commitment to serving these populations and creating a diverse group of healthcare providers. Part of the reason why we give that preference to University of Laverne Leos is because the University of Laverne is a Hispanic serving institution. So we definitely know that by the time someone's graduated the University of Laverne, they've taken classes and they've done community service that emphasizes a commitment to diversity, or at least, at the very least, an awareness of diversity and how it affects our community. So lastly, I'll finish up with just a short piece on why I do what I do and why I am a physician assistant. So I grew up in Southern California in the city of Laverne. I've lived here my entire life. This is a picture of me when I graduated from the University of Laverne with my bachelor's degree in athletic training. And there's a picture of me and my hubby when I graduated from Western University in Pomona with my master's in physician assistant studies. So I have been involved with the University of Laverne for many years, and I've been a lifelong resident of the city of Laverne. So this is my home, this is where I plan to stay, and this is where I plan to serve the people of my community for the rest of my days. I also have a really strong interest in pain management, because I actually have a chronic disease called Ehlers-Danlos syndrome, and it caused me to end up having multiple surgeries. It's quite painful on some days, and I've actually ended up having multiple leaks in my spinal fluid, believe it or not. So I've had back surgery, knee surgeries, shoulder surgeries, you name it. And a lot of the options that were afforded to me at the beginning of my medical journey when I was a teenager were, oh, here, take these pills, and oh, go to psych because you must be crazy for making up these things. And that was totally inappropriate in my experience, and they basically made me feel like this condition was all in my head. So of course I got depressed, and they really would have benefited from having a physician assistant or a healthcare provider who really could have understood, hey, it must be really hard to be a young person and have pain and have so many surgeries, and really understanding that while depression or anxiety may be a component that I was dealing with from navigating such a huge life change, that didn't mean that I was making up my illness, and that didn't mean that if I had a mental health issue like depression, that essentially meant that I had no physical issue going on. So really understanding and treating the patient as a whole in pain management has been really, really helpful for me and also for my patients. So I'm really dedicated to helping people live a life that's in line with what their values are and what sits well with them as a person and what their personal beliefs are. So I choose to manage my condition holistically with my diet, with exercise, with meditation, with herbal supplements and medications. And if that's what my patients want, I'm here for it. That's what I want to be able to support them in. So I really have that strong interest in pain management for that reason. So why did I choose to become a PA in the first place? I have at one point been in a walker. I've had multiple surgeries on my back, on my shoulders, on my knees, and I've dealt with chronic pain since I was 14 years old. My condition causes multiple joints to dislocate, and essentially it's been quite painful for a majority of my life. So that's really what steered my interest in the healthcare field, and becoming a PA was really appealing to me because it was a shorter amount of time than it would have been to become a full-fledged doctor, and I really just wanted to get to work and serve my community. I didn't feel like spending my 30s in school, and I actually finished PA school by the time I was 25, so I was able to be financially independent with my husband. We were able to buy our first home by the age of 25 in Southern California, and having that independence and having the ability to go work was really important for me, so that I could really have a good quality of life in the days that my pain isn't so bad. So I'm really, really happy with my decision to become a physician assistant, and I would do it again in a heartbeat. patient advocacy for me is a big deal because of the fact that I have a chronic illness. So this is kind of an old post. That picture was taken about 2 years ago today, but this was a post from my Instagram that I had posted. And after I started healing from my spinal fluid leaks and my back surgery, I started speaking at multiple patient events and becoming a professional patient advocate. So for me, it's a really big deal to pay it forward and give back to my community and really help people understand what's going on with this disease, how it affects their health, and how I can help them navigate the healthcare system, because that can be a really difficult task. So as far as community education goes, I created a website called healedandempowered.com to really try and help reduce the suffering of others. Part of paying it forward and giving back to my community is sharing education with others. So on my website, healedandempowered.com, you can drop me a line if you'd like to collaborate or stay in touch. People can book an appointment to see me online for cannabis education consults or for consults on pre-PA mentoring or shadowing. Or if you just need to chat for 15 minutes, there's a little sign up area on there where you can touch base with me and I can figure out how I can best help you and help you navigate the goals that you need. Also, you'll find a lot of pain management resources, including information articles and a shop online with lots of pain management products that I recommend to many of my own patients. So, as far as social media goes, please stay in touch with me. So, you can visit my website, again, healedandempowered.com. You can follow me on LinkedIn and meet and connect with me there, where for professional mentoring or guidance or just to stay up to date and grow your professional network, you can reach out to me there. It's my full name, Brianna Cardenas. If you just search it on LinkedIn, it'll pop up. Or if you prefer and Insta's your social of choice, feel free to follow me at Healed and Empowered and learn some of the tips and tricks I share on the mindset towards wellness, pain management tips, where I share my medical journey and what it's like to be a PA. I also offer education on nutrition, cannabis, and patient advocacy. So I hope to connect with you in the future, and thanks so much for watching this presentation.